Hello class, this is Professor Turpin. We're going to run through a quick clip related to care of patients with infection. These are some of the definitions from your book. Knowing that a pathogen is an actual agent that a type of microorganism or germ that is capable of producing disease. The term communicable deals with the ability for infection to be transmitted from one person to the other. Pathogenicity is the ability to cause disease, and the virulence is the degree or the strength, I guess, as you would say, of an agent's ability to be communicated from one person to the other. In our bodies, we do have what's called normal flora, and it's a type of bacteria in different body locations that often compete with other microorganisms, and those kind of prevent other infections from even getting in the system. When you have abnormal flora, sometimes medications and different things can decrease this normal bacteria, allowing the other microorganisms to grow stronger and cause infections. So it's important to kind of know that that can occur. A good example of that is when patients are on some fairly strong antibiotics and then they develop yeast infections because the good bacteria that was kind of controlling the yeast from developing is not there, so the yeast grow and cause an infection. The term surveillance, and I've probably used that in some video before that, really kind of deals with, in a healthcare organization, there is a lot of surveillance of tracking and reporting of infections. We talked a little bit about that with surgical settings. This really deals kind of with the chain for transmission of organisms. You'll see that in your book it talks about the reservoir, and these are the sources of where infectious agents come from. They can come from inanimate objects, or they can come from actual animals or from humans. An inanimate object could be something like a bedside table, and something sits on that, and it sits there and grows, and then someone else touches it, and so people can get, infections from both other people as well as from inanimate objects. The susceptible host means who is the person that is most susceptible to disease. That would be patients who are at the wide ranges of ages, the very young, little children, and the very old are the most susceptible. Anybody that is undergoing cancer treatment or organ transplantation may be on immune suppression treatment, and that makes them not have as many white blood cell counts to fight off infection. There are also some other immune deficiency conditions like HIV and AIDS that makes the patient's immunity very low and not able to combat infections. And then a lot of the chronic disorders that people have, like COPD, end-stage renal disease, rheumatoid arthritis, patients are sometimes on a specific kind of immunosuppressive therapy to decrease their inflammation. Crohn's disease patients and patients with multiple sclerosis. Hospitalized patients are really under a lot of physical stress, emotional stress of their illness, and some of them have had surgery and other invasive procedures, and they're in an environment that is very prevalent for microorganisms, including healthcare associated infections. When you hear the term mode of transmission, that is really dealing with the routes of transmission and methods. Immunity is really the resistance to infection that's usually associated with having antibodies or cells that are acting on those microorganisms to kind of kill them or keep them at a low level in the body. A person can have passive immunity, This kind of mostly deals with when somebody is given like an artificial injection of antibodies, or when the mother gives birth and there's transfer of antibodies from the placenta into the newborn baby. Active immunity, though, is the type of immunity that lasts for years. Probably some of you have had some vaccines that you had as children that were designed to keep you immune to childhood diseases, and so you can have natural immunities to infections, or you can have artificial by stimulating the body's immune defenses like in a vaccine. The routes of transmission are usually internal vessels, that being the respiratory tract, the GI tract, the genitourinary tract, skin or mucous membranes that are open or have areas that can be broken, and then the bloodstream itself. These are just some great pictures to kind of show you some infections. First off, the urinary catheter you can kind of see is very cloudy, a very big strong sign that someone has a bad UTI. This other picture is showing what is a type of infection down in the GI tract that was observed during an endoscopy procedure. In the right upper corner, you can see a chest x-ray where the whited out area is on the side there. That is really showing kind of the infiltrates in the lung, meaning that they have a pneumonia brewing. And then below that, you can see a wound infection that is looking pretty bad and probably needs some treatment. And, you know, we just have to remember that these are the routes that things are transmitted into the body, but there's also methods of transmission, meaning how do these organisms get from one place to the other. Contact can be direct or indirect, meaning that I can walk over and touch you and then you have it on your skin or your body, or I could introduce some kind of infection from my hands to a piece of equipment, and then I put a nasogastric tube down in a patient that's dirty, or I insert a Foley catheter. That is, in a sense, direct because I've touched something, but it's indirect in the sense that it's being transmitted along a catheter that is not a direct method. Droplet can also be when patients have diseases that when they cough, the aerosolized component of that cough and the fluid that comes out kind of stays in tiny droplets that kind of float in the air for a short period of time. That is what droplet precautions is all about, preventing with wearing a mask. Airborne is more strong than just droplet, because obviously droplet does drop eventually, so it's not lingering in the air, whereas an airborne infection stays in the air and is very tiny particles. Vector-borne refers to folks getting infections that come from like insect bites or animal bites, or some type of contamination from an animal carrying it onto you. And then environmental may be when there are contaminated food or water supplies, and then usually there is a portal of exit. Everybody has physiological defenses against infection, besides, having kind of their own body tissues that are supposed to be strong and keep out germs. You also go through, when you have germs introduced into your body, your immune system cranks up. You have what's called phagocytosis, when your white blood cells and other blood cells try to fight off the germ. You often have inflammation that is, letting, kind of containing the infection to a certain area. And then in your patho information, you'll get more information about immune systems and antibody mediated and cell mediated types of immune systems. These are some of the stats just to know how serious healthcare associated infections can be. 1 in 20 patients will develop an infection while they're in a healthcare organization. 1.7 million patients will have infections annually. And this may lead to up to 99,000 deaths each year. The estimated cost of this to the healthcare system is 35.7 to 45 billion, which is huge, and really is a primary driver as to why Medicare and Medicaid and the government has really worked hard on having a lot of initiatives to decrease healthcare associated infections, some of which that we'll talk about. The first one I'm going to mention is catheter-associated bloodstream infections, and even though the acronym says CLABSI, a lot of times this in the beginning used to be referred to as central line associated bloodstream infections, thus the term CLABSI. But it refers to a bloodstream infection that occurs when bacteria or other germs travel down a central line of some sort and enter into the bloodstream. And the bloodstream infection, when you're having those type of things, your patients are going to present with fevers, chills. They may have some redness around the catheter. They may have pain in the area of the catheter that they mentioned to you, or actually heat-associated warmness in that area also. And they can fairly quickly progress on to have what's called septic shock symptoms. And when they're in shock, they also get into hemodynamic instability. And what that means is suddenly, their blood pressure drops, they're, really unstable, and they often need to be admitted to an ICU. Some of the key things that are done to kind of diagnose and see whether someone is having a CLABSI would be to do check their white blood cell count to see if it's elevated, would be one symptom. Are they having vital signs or fever and all those symptoms? And how high have those been? Because there are some real interesting information that's out there where some hospitals actually are monitoring this in an ongoing way that you may see in some of the hospitals that you visit for clinical. Typically, the physician is going to order blood cultures, and those are going to be drawn from peripheral sites, and there's a different procedure for drawing blood for blood cultures than just regular blood. You have to basically, sterilize the site much more thoroughly on the arm where you're going to draw the blood from, or wherever you're going to draw the blood from. And, usually they're going to use like chlorhexidine solution so that they know that when they're sticking the needle in the arm and withdrawing that blood, that when they check the blood, if it grows out a germ, it's not from some surface contamination of, bacteria that was on the skin. And sometimes, obviously, these patients have had a central line or a catheter-associated bloodstream, device of some sort that they're checking. And a lot of them don't have good IV access, and that's why they have the central line in the first place. So just kind of remembering that occasionally a doctor will order for you to draw one of the blood cultures from the central line. And if you should have to do that, there's very special things that have to be done. So you'd really need to check your procedure. A lot of places require, some severe cleansing around the hub, and then even putting on new injection ports that are sterile, that are brand new, so that when you go to draw blood out of that, you waste the amount of blood that you're supposed to, but also so that where you have connected that to draw it, you're not going to get some contamination off of that hub.